Item 12 is the Social Mitigation Action Plan. And Tim, the floor is yours again.
Thank you very much, Chair. We talked a lot about COVID and the acute effects of COVID, but as well as long COVID effects, we're becoming increasingly aware of the wider effects on society as a whole from COVID. And also in recent months, these effects have been exacerbated considerably by issues around, particularly around issues around energy supply and energy costs. So there are a lot of people in communities who are really struggling as a result of both COVID and more recent economic and fuel supply difficulties and inflation and a whole range of different factors. We have recognised these challenges for some time and brought the social mitigation strategy and action plan to the board in May last year. This paper is here to give an update on progress. The main sort of coordinating event was a conference that happened in a workshop that happened in November last year around Build a Better Boat. The idea of the boat analogy is that some people say, oh, well, COVID, we're all in the same boat, whereas in fact we're not in the same boat, we're just in the same storm-tossed sea, but different people have got different boats. So I suppose we might even think of some people in an oligarch's fantastic yacht that hasn't been impounded yet, whereas other people are rather in in perhaps a leaky coracle or something which it is likely to get swamped. So with that analogy, there was work done looking around how further we can implement the social mitigation strategy, and a report was produced on that in January. This is simply an update report. It reflects the work both of the board and also of partner agencies. We're still at quite an early stage, but as well as the report itself, which we believe there's moderate assurance around progress, there's also the more detailed action plan, which is included within the board papers. Joining us now is Linda Thompson, who has been leading the work on social mitigation. So she will be far better at being able to answer any detailed questions than I am, but just present it as set out in the papers, and would welcome any questions.
Thank you for that introduction, Tim, and opening it up to questions now. I have questions from Deirdre and Anne, to begin with. Deirdre, first of all.
Thank you, Chair, and thank you, Tim. I note that the plan is based on the consequences from the pandemic. However, we know now that kind of hurtling down the track towards us is the worst cost of living crisis since records began. I think it was 1946, which is going to be taking the poverty that we see now to an entirely new level. Within the report, it refers to food insecurity, fuel poverty and transport. However, folk are also dealing with clothing poverty, bedding poverty, funeral poverty, simply poverty on the round, and sadly poverty has become normalised. Now, in all my 23 years as an elected member, I've never witnessed such hardship in my community. And what I'm seeing is that no matter how prudently families budget, they simply do not have the cash to make ends meet. And we're about to see that get worse. And as sure as day turns into night, we know that this impacts on people's physical health and their mental health, and upon NHS services that are already very stretched. So what I'm interested in is how this looming situation is changing your thinking in respect of the plan.
Thanks very much. It was a very appropriate question, and I'll bring Linda in a second to talk about some of the more detailed things. It is a difficult question to answer because the challenges are so huge, and certainly one we're not going to be able to address them all ourselves, and it's a matter of doing what we can. I think it simply demonstrates how far bigger an issue this is. Public health and the board as a whole has long been particularly mindful and wanting to highlight health inequalities, and health inequalities are largely the result of underlying determinants of health, whether things like employment, housing, education, and of course poverty. So really it's simply a huge extension of what we need to do, and something that has developed considerably since the strategy was developed, and to some extent it overshadows the strategy as well. So I think what we need to continue to develop the approach and do all that we can, expanding the different areas. So I haven't got an easy answer, because I don't think there is an easy answer to this, and it's something that mainly we need to recognise as such a huge problem, and it's, if anything, it's probably going to get worse over the next few months. So I'll bring Linda in, who may be able to come up with some specific comments.
Thanks, Tim, and thanks, Deirdre, for the question. And you know, I agree with Tim. It kind of feels a bit overwhelming, I'll be absolutely honest with you, and the sense about, yeah, an even bigger tsunami, I guess, coming its way. There are some thoughts I have, Deirdre, but I'll be honest, a little bit like Tim's articulated, I'm not entirely sure what we do. But when you look at poverty, there are three different things, I suppose, in terms of actions. There's increase people's income, which you can do through income maximisation, making sure they've got all the entitlements that they are due, or through employment, or reduce the costs of living. Now, reduce the cost of living, that would be a tough one, to be honest. I'm not sure how we begin to look at that in terms of energy costs and food costs and so on. But maybe there are some things we can do, but I think limited. Equally well, income maximisation, to be honest, we all know what it's like about energy costs just now. We're basically told, don't worry, looking for any other comparison, you know, and income maximisation is similar, although in the past, and we will continue to refer people on to income maximisation to make sure they've got full entitlements. However, I'm very mindful that actually that doesn't actually stop the what's happening at the moment. So the only thing that I think we need to look at is around employability, is around, you know, and that matches in well with our own sense about we have vacancies that we need to fill. Can we do more to support people who need good, reliable, fair work? In terms of, once we know that NHS Highland pays the real living wage, we know that it's, in terms of conditions wise, it's stable job, you know, and so on. So is there more we can do to try and support people into the workplace, if that's possible? And that, I guess that's my sense, Deirdre, about one of the actions that it might be possible to do. It's challenging, I think, but it might be one of the things we could think about exploring. But I'm equally open to any ideas people have about what else can we do about it, because I share the concerns you've just expressed.
Deirdre, do you want to come back on that?
Not that thank you both for your responses, and it's hugely difficult. I do appreciate that, but you're quite right in terms of employment is very much key, and everything that can be done in that respect is helpful. Thank you.
Thanks, Deirdre, and thanks, Lynn. And it's Anne and then Joanne.
Thanks, Boyd. Just in terms of some possible specifics to explore, and Tim, I was glad that you did mention fuel poverty in your introduction. I did flag one of these issues up to Linda earlier, but since then I've become aware of one or two other potential challenges, and so I guess my ask is that we try to look across the board at issues of, and I'm thinking about transport here in terms of fuel poverty. So one of the lay members, in fact, of the Health and Social Care Committee brought an issue to me, and I don't know, Linda, if you've been able to check out the reality of this situation or not, but they were asking a question about the rate per mile that people who are able to claim expenses for travel to hospital or other health facilities can claim. And they were suggesting that it's really quite a low rate. On that front, I understand obviously that this may be a national issue, but if there is something to look at there, then we should be raising it with government, I think. But I've also been thinking about the many members of our staff and also in the independent sector who are delivering health and social care services in our remote and rural areas, who are having to travel to provide a service to vulnerable people in our communities. And clearly, even those rates per mile are likely to be higher than the ones mentioned in relation to travel expenses. But still, I'm sure that some people are really struggling to be able to afford to do their work. And I just wondered to what extent we might have become aware through our work with our providers or our own services of this being an issue, and whether there would be any temporary measures or anything that we could do to provide some relief in that respect, or recognition of these difficulties. Even if fuel costs may well stabilise, we know that that's likely to take quite a long time, and indeed if they do ever, then they're going to be probably substantially higher than they have been in the past. So I suppose I'm suggesting that this particular issue about transport costs could be something that we could look across the board for opportunities to respond. Thank you.
Thank you. I think just very quickly, I'd certainly agree with you, Anne. I think there's been work, I mean, before my time really, on transport, which to a large extent was curtailed through COVID, and the picture with COVID changed, but transport costs are going to be a huge issue in the next few months. So if I ask Linda to comment specifically.
So yeah, thanks. And again, I'm mindful that in the social mitigation plan, transport poverty is actually one of the actions that we've got around there, although in fairness, haven't done a lot of progress on that. I did do a little bit of background checking and I've discovered it is 14 pence a mile for patients. So it does feel as if that needs to be looked at. Apparently, there's lots of stuff around that, and maybe we just need to explore it separately in terms of what influence do we have. It is reviewed in April each year, so will be imminently reviewed, and it's informed by the HMRC apparently. But I think it's been at that rate for some time. So it does beg a question about what should we be doing about that. The other thing is that the patient transport scheme, and this might be something we want to look at as well, was never intended to completely cover all travel expenses. So there's an expectation that people will pay £10 up front, you know, or if it's less than £10 rather, they would pay themselves. Now, in better times, that might have been okay, but perhaps now that's no longer okay. So there is all sorts of things around that. I'm actually not sure what influence we have, or whether that's something that has to be raised within the Scottish Government about how we can best support patients to travel. And of course, my other thought was, I guess, you know, using Near Me and other things like that is one option. Doesn't work in every case, but you know, the first point of question for me would be, do they need to travel at all? Would be kind of one of the first things to think about. But I think it's a point well made and could do with some more unpicking.
Thanks, Linda. And Dave has his hand up, so I think I'll go to Dave and also to Pam. So Dave first.
Yeah, thanks. I waved just because it was on the point of Highlands and Islands patients travel. So we do have discretion locally to change rates within the Highlands and Islands patient travel scheme, and something we should actually be looking at. We do base it upon the HMRC's guidance of the rate that's paid for fuel reimbursement. Bear in mind, people compare the rate that's paid out with those that kind of they get from maybe staff mileage or whatever, but this is purely a fuel reimbursement, whereas those rates are all encompassing, which include insurance and maintenance and et cetera, et cetera. So that's why there's a significant difference between the rates that are actually paid out. But I certainly agree that, and we have in the past in extraordinary times reviewed it more than once a year. So I'm happy to take that one back in terms of reviewing the mileage rate that goes on now. In terms of the deduction, that's part of the scheme. I'm not sure what influence we've got on that, Linda. And again, I can find that out as well and take it back as well.
Thank you, David. Hey, Pam.
Thank you. Yeah, I think as has already been said, where we started with this and where we are now in the changing world, absolutely means we have to really give this an even deeper thought than we did before. And I think probably most people have covered the main points I was going to make. I suppose there's the one about that, you know, what do we do with partners? And I think this does come back to how we work as community planning partners, what commitment we make to supporting communities, and looking at then how we shape our services in terms of access and Fairer Scotland duty to seriously challenge ourselves about whether things need to be delivered the way they are, and where they have to be delivered and where there's travel involved. How creative could we be in that space, not just in terms of the reimbursement, but I mean, people might not have the vehicle, or they might be in a place that even getting to the nearest place to get transport is a challenge. So I think we, in our as we come forward with our revised delivery plans, and as we look at redesign, this has got to be at the heart of what we do, because ultimately this is our prevention agenda, this is our population health agenda. I think as employers, we've got a huge amount of opportunity here, and actually, given their workforce challenges, we absolutely should be grabbing it. As an anchor organisation, we've got a real opportunity and duty to do this well. So again, in line with what we're thinking now and how we're going forward, we should really, again, always have this at the front and centre of what we do. I think the question about whether people actually need to travel for services is a really good question, and that is a real strong question to put back into our services. And I'll come back to Tara's statement of do we design to system satisfy, or do we design people-led services? And this is a great opportunity for us to challenge ourselves further on that. I think for staff, we have had feedback. We have had feedback, particularly from home care staff, in terms of the impact on them and fuel poverty. So we've already started to have that conversation. And I think there are, again, a number of things about our system that aren't very agile in terms of supporting staff to be able to do their job out in our communities, in terms of how do we use our fleet, who has access to it, and how we've maybe done things traditionally versus how we could do things differently now. So I think we've got a massive opportunity here, and perhaps what we need to think about is pulling out one or two of the actions from here that we think could be immediate and high impact, and pursue them. So I'd be very happy to look at that with others and how we could do that. But massively important. It has implications for everything in terms of what happens at a service level if we don't really try and support and pull this back.
Thanks, Pam. Joanne, followed by Alistair. Thank
you. This could be because I've not delved into it that much from previous strategy when the report was issued last year, but under partnership structures, under some of the areas I would have expected possibility of more partnership working within the third sector. And, you know, there's employment opportunities and partnership working that we could be taking advantage of within the third sector across most of these areas. In section 6 on the digital inclusion, there's a lot of work going on at the moment around libraries. The Alliance have been doing pieces, the UHI, and I'm just not clear from the paper if we're actually linking into that work and learning. So there's a question around that. And the capacity and resilience, there's a lot of people have been affected by the latest spike with COVID, and there's more fear in some of the communities from our more vulnerable. And again, I think there's more opportunities for partnership working within the capacity and resilience to try and get people back out and engaged within communities. And I would like to see a bit more of that within the paper. Thank you.
Thanks,
yeah, is it okay to come back in on that?
Yeah,
Thanks,
sure.
Joanne. And you're absolutely right. I think we do need to reflect some more of the partnership working. It is there, to be honest, but it's probably not reflected in the plan. So, for example, we're members of the HIPAN, the Highland Poverty Action Network, which is chaired by Highland Third Sector Interface, for example. And things like our Cash First leaflet and so on was developed in conjunction with that. But I think you're right, Joanne, that there is probably other areas that we need to do more on in terms of linking in. The thought at the time, but we've moved on since then, was we needed to get our own house in order first. So it was kind of aimed at what can NHS Highland do? But you're absolutely right. The next part of that is, and what can we do to support, facilitate, enable with other partners? And the third sector is clearly a major player in that. So yeah, absolutely.
Alistair, followed by Heidi.
Yeah, thanks. Having spent the best part of my working life in this area through citizens' advice, I sometimes sit back and watch the giants that are the Highland Council or NHS Highland or whoever talk about poverty. It's about, I'm afraid, it's about coming down to the Citizens Advice Bureau. It's about going to the Salvation Army Food Bank and seeing people queuing in absolute destitute for food, for basic essentials. It's not about mapping the third sector. It's not about writing massive plans or getting groups to chair summits. It's about, I'm afraid, it's about intervention on the ground with the people that are starving, with the people that are in debt, with the people that can't pay their rent, and with the people that are having mental health impacts and feeling really depressed and almost, not almost, some of them are suicidal at the situation that they find themselves in. And I think it's really about the Community Planning Partnership changing its direction on this and actually, you know, getting serious. We're either serious about addressing poverty or we're not. And if we're serious about it, it's like everything else. It's going to need people on the ground. You know, for instance, NHS could, for instance, decide that every person as part of their discharge package has an income maximisation exercise carried out on them. That doesn't happen at the moment because it costs money to make it happen, because it would need an advisor, either citizens advice trained or elsewhere trained, in order to do it, and that costs money. And I think the time has come where perhaps we have to think, do we want to invest in something like this or not? It could well be as part of every Scottish welfare grant that the Highland Council gives out that somebody has a benefit check or an income maximisation exercise. It could be as part of every signing on exercise for universal credit that a conversation is had about employability and jobs and training. But until there is a real shift in belief and desire backed up by resources to address poverty, then poverty will be with us and won't be addressed, and people will carry on, suffering the way they are. There's an awful lot that can be done, but it's about action now rather than anything else, because I've not seen anything like it in my time in the sector, of debt, of desperation, and of hunger, including people that are in employment. Perhaps most exceptionally now, it's the working poor. It's not the people that are fully 100% on benefits. It's the people that are just above that safety net that are now falling down, and the interventions that were in place to actually help and save them don't apply, because they earn a fraction too much that they miss out on all the help that they need. And they're the ones that miss out on everything, and the ones that we need to reach out to together with everyone else. But this is going to be a really big exercise for the next 5 to 10 years, probably worse than the casino banking problems of 2007 or the last major recession. This is going to be a lot worse for us, for health implications and for people's well-being. Thank you.
Thanks, Alistair. Tim, Linda, do you want to respond?
I mean, just to come back and certainly agree with Alistair, and in a way, the social mitigation paper is a bit paltry, because it looked at one small part of that of what's turned out to be a huge, bigger picture. That But what I am pleased about is that it does raise the issue and allow us to have that discussion, because the poverty, whether fuel, food, wider, simple, people just being too poor to look after themselves and their families, is a huge impact on society and a huge impact from health. And even though the paper to some extent just scratches the surface a bit, at least it then opens it up to how we need to prioritise what's most important in people's lives. And Linda may want to say more.
I'm mindful of time as well, but I would just echo, Alistair, what you've said. We have the Cash First leaflet and money counts training that we offer to anyone around using it, how to ask the question about money worries, and importantly, particularly for our staff, what to do if somebody says, yes, I have money worries, because we need to know how to signpost. And I have a vision. You've talked about discharge, Alistair. I'd like to see it asked on every admission as well. However, I do need to acknowledge that if we did that, we did it successfully, the people that would be referring on to welfare support team or to CAB would exceed the resources that are currently there. So there is a consequence to doing that, isn't there, which we'd need to look at around, is there capacity for people to get entitlement checks? And then there's a reality about, even with all the entitlements in the right place, I still suspect we've got a challenge on our hand, but at least it would be a step in the right direction.
Okay, Heidi and then Sarah.
Thanks, Boyd. I just wanted to go back, if that's all right, just to talk about rates per mile in terms of reimbursement. 2 weeks ago, I met with some health visiting and school nursing staff from the Highland Council, and this was something that they raised with me in terms of the impact on them. So health visitors have a set number of visits that they have to make to women who've given birth, but over and above that, they have other reasons for visiting too. So they do a lot of travelling. And they are very concerned about the cost of fuel, and they get a flat rate, of course, but the cost of fuel is going up. And also they are capped at 3,500 miles. So once they have travelled 3,500 miles, they start to get a lower rate for their petrol reimbursement. So I spoke to the Royal College of Nursing and also HR about this, just to see what was happening. And the NHS Staff Council apparently review mileage rates twice a year in April and November. So they're about to review the mileage rates that staff get, and we should have an outcome of that by May. But the trigger for change is a 20% increase or decrease over a 12-month period. So working that out, we're not likely to see an increase on this occasion in mileage. So the RCN have called for an urgent review of that, and have cited the fact that there hasn't anyway been any change in rates since 2014. And they're also calling for overnight subsistence allowances to change as well. And that's the amount of money that people are allowed to spend on food when they're away on health business. So I just really wanted to let people know that, because this is a very real situation for our staff and they're directly impacted on here.
Thanks for that information, Heidi. Sarah and then Gaynor.
Thank you. I'll try and be quick and not to repeat anything. It is again about the travel and subsistence. I wondered if there was an opportunity to maybe take a small working group offline with Dave or colleagues to specifically look at travel and the process for claiming expenses for people in island communities and other rural communities. But obviously that's me looking at it from my own perspective. Just while everybody was talking, I did a really quick calculation. So the cheapest I could get from here, door to door, to an outpatient appointment in Glasgow would be £168. That's using public transport and the cheapest possible accommodation. And sometimes, obviously, there's an element around actual figures, but there's something about the process as well involved in claiming back and a cash flow consideration, I guess. But I'd be really keen if we were going to maybe take that offline to join a small group to discuss that and look at the sort of practicalities of that as well. Thank you.
That sounds like a good idea. Maybe Pam can respond or Tim can respond to that later on. Gaynor.
Thanks. Just reflecting what Heidi was saying and this whole conversation around mileage. So, for example, I think mileage or business mileage is set by HMRC at the 45 pence per mile. And it does drop if it exceeds a certain amount, but on HMRC's website at the moment it's saying it would drop to 25p if you exceeded £10,000 miles travel. And the reason that HMRC have obviously set those rates is because of the tax implications, but it sounds like we might be able to change, maybe not the cost per mileage, but potentially look at the time or the number of miles that cost would then drop to a lower rate. So I think there's a little bit of wriggle room, but obviously some of it is put in place by HMRC and the government due to tax implications. So there'll be some stuff that we won't be able to change, but I think there's definitely an opportunity there.
Thanks, Gaynor. Fiona maybe wanted to respond to that. Fiona.
Yeah, and just to sort of follow up on Heidi's point as well, this has been urgently looked at nationally in terms of the whole setup, because it is part of the national terms and conditions how this is set. As you say, there's a slight difference. There is always a staggered approach to mileage for colleagues, because as Dave Garden mentioned, it's not just for fuel, it's for the sort of wear and tear on cars, etc. So there's a higher rate for the first mileage. Interestingly, I say that the rates are different within the NHS terms and conditions. They're actually 11p a mile higher at the top rate, although for a lower amount of mileage, and then goes down, as you say, to slightly below at the 20p a mile. So we know there is a discussion happening nationally, and the Scottish Terms and Conditions Committee have agreed that if progress isn't made in a very rapid timescale on that nationally, then we'll look at it across Scotland to make sure that we're not disadvantaging people. But the other thing that we also look at for colleagues in rural areas, particularly who are doing significant business kind of mileage, we also look at whether or not there are pool cars, pool vans, or also kind of lease cars that have been returned that we can utilise, so at least people aren't using their own personal cars. So those are all options we've explored, but we hope to hear more in the coming weeks about that.
And finally, Alex.
Yeah, just to follow
up on the fuel stuff, but do we use, or have we used in the past, fuel cards rather than having people to claim the money back? That they actually get a fuel card with an amount on it that they can then spend, obviously on business fuel, not on their own fuel, but that gets round that particular issue of having to claim it back, because when you go to fill a tank up now, you've got to put a fair bit of money out before you can, move away. Thanks.
Okay, just before I bring Pam in to respond, there's also a section in the actions about food waste and distribution. It seems to me that that's an area that we can directly influence ourselves and take action on. Pam?
Yes, thanks. I mean, in terms of all the discussion about mileage and staff mileage and all that, there is a mechanism there, and that will get attention drawn to it. So that's that, and I think it's fine for us to look at a short life working group. That's excellent. I probably want to take us back to the poverty of people in communities and the devastation that's been set out at the start of the meeting, and where there maybe aren't sufficient actions in place, and probably take Alistair's challenge of, what are the couple of things that we could do really robustly that could have a here and now effect, with all the power and might that we've got as an organisation alongside our partners, that really supports local communities who will have many people in a devastating situation, and as Alistair said, many in work in that, and some working in health and social care, who have got in work poverty. And so I think that I'm not demeaning what we've been talking about in terms of our staff and all that. That's really important, but the mechanisms are there just to address that. I think this really speaks to is where there is no voice, where people don't have a voice, and there isn't natural mechanisms for them to be picked up easily. And I think that's the challenge as a board, and as a mighty organisation, that we probably want to pursue further through this.
Okay, Gaynor's having the final word.
Sorry, Boyd. It was just to pick up on your point there around food waste and redistribution, and also what Pam was saying there about also maybe some quick wins. And we're an anchor organisation. Community fridges are springing up everywhere. That's one way to be able to get our food that we haven't used but is not ready to go to landfill, potentially into the hands of anyone who either needs the food or who would be able to use the food rather than it going into landfill. So I think that's something that I know there's a little bit of behind the scenes organisation that would have to happen, but potentially rather than even having communities run these fridges, we may be able to have them ourselves on our premises, particularly in remote and rural areas, which are probably quite poorly served for community fridges. There's a lot around the kind of Inner Moray Firth area, but I'm not sure how far they reach out with that into rural, and certainly not into our remote areas. And it's a real area of interest to me. Thanks.
Thank you again. I'll just give an opportunity to Tim and Linda to respond.
Sorry, Tim.
No, just to say that I think it's been a very, very helpful discussion, expanding on the work from the social mitigation strategy and action plan, emphasising the vital nature of this, particularly as Pam was saying, for the communities that don't have a voice, and the challenges that Alistair set out are absolutely vital. And I think it's I think there are welcome challenges for what we need to do as an anchor institution, and the really big heft that we've got to be able to improve people's lives and improve people's health. So I'll just hand over to Linda for that's the final word.
Sorry, yes, I'm aware of time too, and I'm just picking up the challenge, Pam, that you've thrown out around what two things. And for me, that's around increased income. So that's through work. What can we do as an organisation? We employ a lot of people. what can we do to influence that? And where that's not possible, what can we do to make sure people have got the full entitlements of the income maximisation jobs? Those to me would be the two things we would want to concentrate on. Those are anti-poverty reactions, and the food stuff and the fuel is all part and parcel of that. But to me, those are the two hard-hitting actions that I would be wanting to look at.
Thank you both, Tim and Linda, for bringing this report to us, and you can see that we're clearly exercised as a board by it and recognise the challenges around it and our responsibilities as a major employer around this whole issue of poverty. And we're being asked to endorse the action plan and to take moderate assurance from the report. Are we happy to proceed on that basis? Yeah, thumbs up. Okay, thank you. Bearing again in mind what Susan was saying about moderation and what that meant in practical terms. We move on to item 13, the Culture Programme report, and Fiona.
Thank you, Boyd. Yeah, so we continue to make good progress, although because of the time lag since writing the report in late February for the governance cycle, we have had to pause temporarily on delivery of the Leadership and Management Development Programme in March, and that was due to the impact of the further surge in COVID cases. We don't do that lightly, but maintaining the quality and safety of care and increased demand for services alongside probably the most significantly reduced colleague availability we've had in the last 2 years means that we always have to protect delivering our essential services. Team conversations pilots and the next modules of the Leadership and Management Development Programme will restart as soon as the capacity within teams is stabilised. So it's all there and ready to go, but it's important that we don't add another pressure onto people in terms of attendance at courses when we're under such sustained pressures. Other things just to note, our people plan, which is going to set our delivery priorities for projects right across the people and culture space for the next year and also beyond, is being finalised to go into engagement and input over the coming weeks. So we'll be taking that to Systems Leadership Team, Culture Oversight Group, the Partnership Forum, Staff Governance Committee. And that's really all about sense checking that we've captured the priorities, the resources we've got are aligned to the right things in the right sequence. And that's really important because whenever we've got scarce resources, we need to make sure that we're not trying to do too much with too little, and that everyone's agreed what those priority areas look like. So we would be looking to bring a high-level summary of that as part of our May update to the board. We're also making good progress now with developing how we wish to roll out our approach to civility saves lives and promoting professionalism. So over the last couple of weeks, we've discussed this with the Exec Directors Group and got really good input there. We also discussed it yesterday with the Culture Oversight Group and again got further thoughts and ideas. It is really essential that we take the time to consider how we want to do this. There are lots of different ways of implementing civility and professionalism, and engagement right at the outset is crucial. We'll be forming a dedicated project team with resource and a milestone plan, and we'll be setting out key deliverables for what that rollout will look like, what supporting materials, tools, data, etc. are going to be needed. We have looked at a range of different models and we have taken a number of learnings from the Vanderbilt University model in the US. But we now know we need to customise this to our own context to make sure that we can roll this out to all of our colleagues across Highland. And ultimately, this is about having a peer messenger system that helps us to address incivility and poor behaviours locally and informally. And that's not just for the benefit of our colleagues, but also for the benefit of our patients and the people that we look after. And as part of this, we need to be able to clearly articulate what the behaviours and standards we all want to live by. So it is a major piece of work and it will take a lot of time and effort to deliver. And it will be a combination of work between the project team and also our core teams across a range of areas. We'll need patience to do it well and properly. And that's why we want to start with a clear plan, realistic milestones, clearly articulating what resources we need before we begin the work. But this really is one of the key ways that we're going to start to make a difference, that every colleague can see where they work and that our patients and our service users will see too. We're also hoping to have our draft wellbeing strategy and plan into syndication towards the end of this month, and that will give us a clear view of the wellbeing activity that we've currently got in train, but also the activity that we wish to commission and develop over the next year and beyond. We're also moving forward with our culture metrics and our wider approach to people data, and we talked in the IPQR section that we're doing a really intensive look at how we give assurance to the Staff Governance Committee and on to the board, and so that work will be coming to fruition in the coming weeks and months. To the point around the level of assurance, you'll note that I'm proposing we take moderate assurance. This is really recognising that we can't ignore the impact that the latest surges in COVID have had on our planned rollout of key items. We are continuing to make progress. We do have the resource ready to restart, but we just have to ensure that those who need to engage in this process have got the time and space to engage with this and to get the benefit from it. I'd hope that by the time we get to May's report, we will be able to give a substantial level of assurance, and I would see that if we've got our people plan, our wellbeing strategy and our milestone plan for promoting professionalism in place, that would be what we need to get us to that level of assurance. So I'm happy to pause there and hand back to the chair.
Thank you, Fiona. And can I open it up for questions? Bert.
Thank you, Chair. Thank you, Fiona, for your input. I attended the Culture Oversight Group meeting yesterday and I learned about the Civility Saves Lives strand of work that is underway. Very interesting. And I think, as Fiona said, with some adaptation, it's something perhaps that the board might wish to implement here. For me, a lot of that seems to be just common sense about what is part of that process. But I think a fundamental part of it is the responsibilities that managers must take to ensure that they are doing what they can be doing to avoid us getting into a situation where we don't want to be. So whether it is that model or any other model, I think that's an important part of it. A comment and a question in relation to the people processes. The training and awareness for managers and staff and the Once for Scotland policies. I'm just interested, I know that work is underway. I'm just interested to know the methodology that is being used for that. So how is that training and awareness raising taking place? And also as part of the scope of the people processes, part of it relates to implementation of case reviews, lessons learned, and case auditing processes. I'm assuming that that relates to HR cases, perhaps grievances, or perhaps whistleblowing for that matter. And I suppose the thing I'm left wondering about is, if that is being included now as something that we want to do, is that an indication that it wasn't happening before? So thank you.
Thanks, Bert. Fiona?
Yeah, thanks, Bert. And I think in terms of the questions around training, I suppose there's two different elements to that. I think when we rolled out the Once for Scotland policies nationally in early 2020, there was a sort of suite of training materials about the policies and how to apply them and some of the practical things around them. We delivered quite a lot of that training and we continue to do so. However, I think probably the most important training that we do is that leadership and management development training at all four levels of the programme, because that really does help people understand the core skills of managing people, of listening to people's concerns, of hearing them, of taking them forward. And sometimes we focus too much on the processes. As we talked about yesterday with the Culture Oversight Group, ideally the number of times we end up having to go into a formal people process would be significantly reduced if we could resolve things early, informally, using using conversations and skills of managers to pick that up and to be advised on how to support it. So I think there's always a place for practical training, particularly actually kind of at the point where people might have to be embarking on some kind of a change or some kind of a process. But I think our biggest kind of focus here is all about that ability to respond to concerns and to support resolving situations. In terms of the case reviews and audits, it's something that has been done, but not in a sort of focused way. And again, that's part of what the work stream is looking at, getting into a real rhythm of, at the end of processes, look back to see what went well, what could have gone better, and doing that collaboratively. So that we do that with colleagues and staff side, kind of management and the people team. In supporting that, because there's learnings from all of these kind of processes. I think the more challenging area to get learnings from is when we do successfully resolve things informally before going into a process, and that's one of the other things we're keen to do is almost to collect. In that case, it's more like kind of case studies almost, or stories of what did a particular manager or colleague when some kind of informal resolution or early resolution worked, what did that look like, what did they do, and how did they go about it. So I think that all forms part of that suite of what we need to do.
Thank you, Fiona. Just a couple of things. I hear what you're saying about this, the training and awareness being part of the leadership programme, and I fully understand and agree that that is an appropriate place for it to be. But it does leave me wondering about those individuals who are not on that programme and how you reach these individuals. So it's just something I would leave you with, I suppose. I suppose the other thing is that the learning from these case reviews, in my view, certainly is absolutely vital. So that if something has gone wrong, then we need to learn from it. And equally, if something has actually gone very well, we need to learn from that too. So thank you for your explanations, Fiona.
Thanks, Bert. Alex.
Yeah, thanks, Chair. Yeah, thanks, Fiona. Thinking and building a little bit on the discussion you just had with Bert, at the end of the programme, once we've got to, shall we say, normal operational work, is there any intent to put the training, both the leadership and development training and the people process type training, any intention to put that onto statutory and mandatory? Because from what you just described at the start about the 4 different levels of particularly the leadership and the management one, I would have thought it might well need to be as a kind of mandatory. I don't necessarily think statutory, but I would suggest mandatory training, which of course brings us back to that's increasing the amount of training on the mandatory side of things. Something to give some thought to. Thanks.
Fiona, do you want to come back on that one?
Yeah, and just to quickly say, I completely agree, and I think, as you say, we've taken a lot of this training and deployed it in a bit of a programme way to try and kind of get a sort of structured approach and resource behind it. This will be business as usual activity, and where we want to get to as an organisation is that we train people up. They gain their licence to operate before they start in that job. So at level 1. For me, some of the most important training is actually that level 1 and level 2 leadership and management development. So actually, we're in a process whereby we spot that somebody's likely to move into a supervisory position in the near future, and that actually before they move into the job, we've got them doing that training and having that support and understanding what that role entails, and therefore I do think as part of our review of induction, training, development. We need to be clear about what training should people do at what point in time, and the benefits we've got now of how we can deploy training is that we've got quite a lot of the training is available to sort of self-serve online to get to get the initial taster of it, and we're less reliant now on having to bring whole classrooms of people together, but actually built into those programs, what we like to do is build a bit of a cohort, so there's also some action learning and follow up and support outside the classroom.
Yeah, I think Fiona kind of covered the kind of, I think when you get promoted into a management post, leadership post, you should almost be on a trajectory with a license to practice in that area, because traditionally what's happened in the health service, and I can speak about myself because I know myself, who's gone right through the ranks and quite often had to seek out, when I was in middle management, my development because it wasn't naturally there for me. And so we take people who are very good clinicians often and practitioners and put them into management and leadership jobs, and then we do nothing to help them do them well. So I think the structure by which we do the training is something we need to work on, and I agree that it probably should be absolutely a given that in a promotion you get set off on the right path with some of the right knowledge that you need to be able to do your job right. But I think it's equally about much more than training. This is about the support and the ongoing development, appraisal, objectives. How are you doing? What are you not doing so well on? This is what I've noticed about what you do. Those conversations that just have not been happening at the level they should be. And the honest kind of, I guess the Vanderbilt stuff is about that kind of ethos of honesty and self-regulation and peer regulation. So you may drift on a given day and not quite get it right, given the pressures that you may be put under. And middle management, you're between the devil and deep blue sea. So how do we support people in that very, very tricky space? Because most of our people come to work not to make life miserable for people, not to be awkward, because they're in a system that's really sometimes very difficult to navigate. So for me, the training is really important, and if we could place that much more early on in people's careers, that would be helpful, but it's still much more about our ethos. So we've got that. That's why the points, the where we want to go next is so important, and it is common sense. Treat others as you'd want to be treated yourself, and be honest. But human beings, we don't naturally always land there.
Thanks, Pam. Bert, did you want to come back in? No.
Yeah,
Okay.
Yes, I did. Thank you, Chair.
Oh, sorry.
It was just to pick up on what Alex said, and I was actually going to mention it in the agenda item about the whistleblowing standards, and it was in relation to statutory and mandatory training. I was in a meeting with the Cabinet Secretary 2 or 3 weeks ago, and he spoke about the government giving consideration to whistleblowing standards being part of statutory and mandatory training. So there are some linkages, obviously, between the whistleblowing standards and the wider culture thing and the Ones for Scotland policies. So it was just to make that point and to reinforce what Alex said. Thank you.
Thanks. And is that a legacy hand, Alex? Okay.
Yes, it was, sorry.
Thanks. Just one point for me, Fiona. How close are we to getting the listening and learning panel set up?
Yeah, so we're pretty much about to launch that. We even got ourselves lined up with some admin resource to support on that. They have just been temporarily helping out with our staffing pressures for healthcare support workers in New Craigs for the last couple of weeks, but they're due to come and join us in the next week or so, and we're all ready to go. We've got the names, etc., ready to go out as soon as that comes online. And
can we do that with a flourish of communication as well around it, of comms?
Yes, absolutely. That's part. We want to make sure that there's kind of external and internal comms around that, so that people, before those letters land on people's doorsteps, they know what they are and what it's about. So absolutely, that's part of the plan.
Okay, any final points from you, Fiona?
No, I think that's been a helpful discussion. Thank you.
So we're being asked just to take moderate assurance from Fiona's report for the reasons that she gave. So are we happy to do that? Okay, thank you. And Fiona's on again for item 14, the quarterly whistleblowing standards assurance report for Q3.
That's great, thank you. So yeah, we've now started to get ourselves into a bit of a routine with the report. So this is the report from the quarter October to December 2021. Just looking ahead to the reports that you can expect to see in the coming months, we'll have a Q4 report in this same format that takes us up to the end of this month, and that will come to the May meeting. We're also pulling together a separate annual report, which will come in July. We're working on what that'll look like. The INWO has just provided some additional guidance on that. And one of the things around that annual report is that we really want to make sure that in addition to a sort of detailed exploration of what we've done so far and where we still need to go, we want to be able to produce a sort of infographic that pulls out some key information in a user-friendly and accessible way that we'll be able to share with colleagues in the wider public as well. I would just highlight we did have to make some small adjustments to the data in this report. This was just due to a couple of errors in past reports. We'd got a bit enthusiastic and recorded a new whistleblowing complaint in Q2, but actually my calendar skills were slightly off because the report was made on the 1st of October, which of course is the first day of Q3, and I'd got a bit enthusiastic and put it into the Q2 report. That was the only Q3 complaint we've got, so we've sorted that out. There was also just another minor issue that there was a Q1 complaint that had been completed. It was initially recorded as not whistleblowing, but it should have been recorded as a stage 1 concern that was resolved. So again, we've just updated that and explained that in the report. So to date, since the process started in April, we have had 4 whistleblowing concerns. 2 of those have been resolved and 2 are still open at the time of the report, although one of those has actually been closed early in 2022, and you'll see that in the new report. And we've had a further 9 complaints that were not found to be whistleblowing. Our stage 2 complaints do tend to take some time to resolve because of the complexities of the issues we're addressing. But I think all of the complaints we've had so far in this have been an opportunity for us actually as an organisation to look into areas of service provision, service delivery, kind of quality and standards, and really get underneath that and make some good learnings and solutions for people. We should be on track with the draft summary of the overarching whistleblowing standards document. So that was the final kind of action from the audit, and we'd be hoping to share the first draft of that with the next oversight group, which is meeting in April. And the idea of that was really just that we've got all of the national guidance, the national website, etc. But we wanted to pull something together that was Highland specific and easy to navigate, that people can access through the website and other tools to sort of summarise what it is that the whistleblowing standards are, how to access them, and draw things together. So that should be in draft form, I say, in April. And just to confirm again, I'm proposing moderate assurance be taken. I think we are making good progress and have some good systems and processes in place. But I think, as we've talked about, we need to continue to promote the awareness of the standards, the completion of the training, and particularly, I think, to complete that one outstanding action from the audit that's due at the end of this month. So again, I would hope we'd be in a position by the time we come forward in May, if we've closed down that action and continue to promote the standards, we might be in a position to look at substantial assurance.
Thank you, Fiona. Are there questions for Fiona on this paper? Bert?
Thank you, Chair. Thank you, Fiona, for your input. I agree with everything that Fiona is saying. Perhaps just 2 or 3 things that I might add for the information of colleagues. I touched upon it in my remarks in the last agenda item, the meeting with the Cabinet Secretary. which was held 2 or 3 weeks ago, the first meeting that has been held with the Cabinet Secretary since the introduction of the standards. And I wanted just to mention a couple of points that came from that. And one of the things is the view that there should be a very strong link between whistleblowing and culture. And of course, that has always been the approach that we have taken here. And it was reassuring, and I hope the board find it assuring to learn of that. I think the Cabinet Secretary made what I consider to be a very telling remark, which was that if the prevailing culture does not allow people to come forward and raise concerns, then the standards actually serve little purpose. So I think the approach that we've taken to make that strong connection between whistleblowing, my role as a whistleblowing champion, and culture has indeed been the right step to take. And I suppose just the only other thing, no, maybe more than one other thing, the Cabinet Secretary was encouraging visits to different areas, but of course we've been doing that now for, I guess, a year and probably more. The communication aspect, which again we've talked about so often, and just a couple of other thoughts from myself, perhaps. We're approaching the first anniversary of the introduction of the standards, certainly in practical terms, and I think it's good practice as we approach that milestone, perhaps just to stop and take stock of where we are, what we've achieved, what we haven't achieved, where we need to get to, and how we're going to get there. I guess that links to a certain extent with the internal audit, but perhaps goes a little bit more than that. So if the board was so minded, then I think it would be a good idea for the next board meeting to add to what's already been highlighted by Fiona and just let the board know where we are, because there is still a bit of work to be done in terms of implementation, and we've said that, you know, all along the line. So I think from an assurance perspective, it would be useful for the board just to know where we are with that. Thank you.
Thanks, Bert. And there is an annual report required too, is there not, Fiona?
Yeah, that's right. And having that discussion, you know, potentially in May would give us an opportunity to just make sure we capture all of that in the annual report, which hopefully we will have ready for board in July.
Okay, thanks. Any other questions or comments about the Whistleblowing Standards Assurance Report for Q3? I suppose it's striking that there are only been 13 cases brought forward in the three quarters of the year so far, and that only 4 of them constitute whistleblowing. And one would hope that that is not because it's not been known as an issue, and that there's not people aren't cognizant of Bert's role. But the more we can do to publicize the standards and Bert's role, the better, and the more comfortable we can feel about a lower level of reporting.
And maybe one reason why we probably have almost slightly preempted the standards is that in introducing the Guardian service, obviously colleagues have got that route, and I think, you know, in the first year of the Guardian service we had around about 150 contacts with them, so I think that for us, some of the lower level concerns or less formal concerns are also being picked up there. And I think that combined picture that we take from the Guardian service and from the whistleblowing standards gives us a bit of an insight. But there's definitely more work to be done in terms of making sure everyone is aware of both of those channels.
Okay, thanks. Are we happy to take moderate assurance from Fiona's report? Yes. Okay, can we move on then to item 15, the board risk register, and to Boyd the Younger.
Thank you. I better not reply directly to that terminology. Thank you. So colleagues are asked to note that there's an update paper, an SBAR, very simple SBAR to state that as per our system now, the risk register continues to be reviewed and updated when required. I think the key thing to note today is that where the risks sit in terms of their assessment hasn't changed since the last board meeting. So there's no material change. There'll always be minor tweaks to the odd little bits sitting underneath that, but the headline is that the risks remain as they were at the last board, and we haven't added any, and we have not increased or decreased any. They remain as they were at the last meeting.
And
So,
sorry, on you go.
No, I was just if I leave it there and happy to, if there are any points to note on the paper or on the risk register, this is happy to hear them.
We had the context of the development session recently, and the paper that you tabled for that meeting is something that we should come back to possibly at the next meeting to develop our position statement on risk appetite.
Yeah. Yeah.
Any questions for Boyd on the risk register, the update? No. Alex.
Yeah, thanks, Boyd. I was going to say Boyd Senior, Boyd Junior. I don't know how you want to name it. Looking at the risk register, not in the actual appendix, but in the SBAR itself, and I couldn't see it in the risk register in the appendix either. Have we actually got any recording of the unmitigated risk, the risk that we started with before we started putting actions in place? Because if we do, it's fine, but an awful lot of these risks are exactly the same in terms of the level that we're recording them at, even though we have in the comments a list of actions. I'm sorry, I'm getting some work done in the house. That's that buzzing you're hearing behind me. I've got a joiner cutting a floor at the moment. So how can I get a handle on, you've done all these actions and yet nothing's happening? Now, is that because it's time related, and therefore in time it will come about, or is it there are more actions required, or are we just happy to accept the fact that in many of the cases we're sitting at high and we will remain at high?
Yeah, so I don't think there's an easy answer to that. I think what we'll see in time, as we said at the board development session, is that we'll get as the strategic objectives emerge, we'll be able to see more risks that are related to the strategic objectives. What we've got at the moment has developed over time, and the overall rating may not have changed, but all risk is constantly changing, and mitigations also constantly change. But that more quantum leap that happens between one level and another hasn't occurred for any of the risks that are listed in our board level risk register. That's not to say that there haven't been changes below the headline statement about that final assessment piece. And equally, there are an awful lot of risks that sit at level 2 and 3 in the so at chief officer and corporate level, and also down in the various parts of the organisation where there's an ever-changing risk picture there as well. So it's difficult, therefore, to see change, but we have seen change, and you can see if you look back through the document that there were some that have changed and have dropped from red to amber, and then that's been sustained. I guess that reflects some change, but the pace of change may be quite slow in terms of those overall ratings. What's happening underneath the surface, though, there are always constant efforts to improve the mitigation side and to consider what else needs to be, are there other things to be added, etc.
Thank you, Boyd. I've got Fiona and then David. Fiona.
Yeah, and it was really just to note to that point about updates. And I think in the SBAR itself, something's gone slightly wrong with the description of the 632 risk, which is the culture risk. But whilst the risk itself is still the same, we have updated the actions around that following discussions at staff governance to ensure that we capture, as part of our cultural risks, the risk around poor compliance with statutory mandatory training and other elements to that. So it still sits beneath that broad cultural risk, but that's a specific update in terms of the actions and the plans that we'll be tracking as part of that.
Thanks, Fiona. David.
Yes, thanks, Boyd. And just to sort of emphasise, as you look at the individual risks themselves, I mean, just two or three that I would try to move forward. You know, we've talked already about the workaround strategy, for example, and developing our long-term strategy, so that work continues. I dare say we'll take the risk of that down once we start to publish the outputs of that. Equally, challenge around remobilisation. We've talked about the system pressures that were under the plans that we've submitted, but we recognise that's still of high impact to us. So despite a lot of work going on in the background, the risk rating has stayed similar. Probably the one that's changed in a different way is around cybersecurity. There have been a lot of mitigations that we've been doing both nationally and locally in that regard, but recognising that the external situation has meant that the risk of cyber attack, for example, that's only one element of cybersecurity, but has increased given global events at the moment. So it is dynamic in that regard, and sometimes the risk is an external element of risk as opposed to what our response might be to that. So in some ways, because they're sitting at quite a high level here, they are likely to move more slowly in terms of that grading, but just to give some assurance that there is a lot of work going on, that it might not necessarily be represented in the slide update.
Thank you, David. And now final word from Boyd.
Yeah, thanks. Just to close off a little on I suppose the several things that are linked that we've just discussed. And so in summary, the strategic risk register represents strategic risks. We will link those to strategic objectives. They are kind of linked already, but we'll more formally do that. Each of those risks has an executive risk owner. So there's a risk owner for each of them, and each time it's an exec. Some execs have got more than one, and each exec should be and is actively reviewing both the overall status of the risk and also everything that feeds into that. And then at the moment, the communication about the status of the risk, if there's a change to be made, decided by the exec and their team or through the relevant governance committee, that change would be through Miriam Morrison, the Clinical Government Development Officer, a manager. We think that we will probably move the risk register across to sit closer to where strategy sits, and so therefore the link is easier or more obvious, and so therefore the comments, particularly from Alex, that have come in, these are in a sense not just for me as the lead exec for the getting a risk register. They're actually comments that are for the execs that are risk owners. And I simply state that while it may seem obvious, it's just to make sure that there's clarity that that's the case. And then the risk owners, along with their relevant governance committees, and with any other teams that feed up to them around those risks, those risk owners, the execs, would then communicate that to whichever the nominated person is to collect and collate into a risk register, which is what we present then at meetings such as the board. And we will continue to do that and bear your helpful comments in mind. So thank you.
Yeah, thanks. We're being asked to note the strategic risk register update and to take moderate assurance from the report. Are we happy to proceed on that basis? Yeah, thank you. And we now come to a raft of items on governance, first of which is the review of the governance light arrangements. And I'll ask Ruth to speak to that.
Thank you. Yep. So board members will recall that you took a decision in November to prioritise your essential business at your board and committee meetings, and that you also agreed to scale back your development sessions for the remainder of the financial year so that the ongoing demands of the pandemic could continue to be addressed. And you agreed at that time that we would review that situation at this particular meeting. So due to the ongoing pressure on the organisation to address the pandemic, and since NHS remains on an emergency footing, the report recommends that the current scaled back arrangements should be extended until the end of May, again subject to further review at that time. So the report asks you to agree to do that. And I'm offering substantial assurance at this point in time on the grounds that this is a proportionate response with essential business continuing to be undertaken. The adjustments don't apply to remuneration and the audit committees so that they remain independent and can retain a governance oversight of your non-COVID related business. The weekly meetings of the chair and chief exec continue. And of course, this is just a temporary measure and will be reviewed again. So the board's invited to agree and to note that situation.
Any questions? Any points for Ruth on that one? Just one small point for me, Ruth, on a second bullet point. The IJB chair should now be included in the weekly meetings.
Yeah, okay.
Can I take it that we're happy to proceed on the basis outlined by Ruth and to take substantial assurance? Thank you. Can move on then to the suspension of standing orders in regard to the extension of a co-option onto the Audit Committee. Ruth?
Okay, so yep, you agreed to appoint somebody to your Audit Committee in April last year. And the board's standing orders and the audit handbook give you permission to do that on the basis that that is for a 1-year period maximum. Now, the appointee has made a significant contribution to your audit committee, and the audit committee chair and the board chair are both supportive of extending that arrangement for a further 2-year period. But that has to be subject to the necessary agreements and of course subject to the consent of the appointee. So given that this has conflicted with the national guidance and the board standing orders, discussions have been held with external and internal audit colleagues, and we've sought and received consent to extend the arrangement from Scottish Government. So On the basis, therefore, the board is, on that basis, therefore, the board's asked to suspend its own standing orders 9.7, which controls the length of time that someone can be co-opted onto a committee, to extend that co-option arrangement for a further 2-year period with effect from 1st of April. So I'm offering substantial assurance on this course of action in acknowledgement that while it does override national direction, we have got Scottish Government's agreement to do so, and the suspension of standing orders would also give you that latitude to do that, and it's specifically for this particular arrangement and not for any others.
Thanks, Ruth. Any questions? Any comments? Alex?
Just a quick check, Ruth. By suspending Standing Order 9.7, is that just specifically for the Audit Committee and it says that, or does Standing Order 9.7 cover every other committee and therefore you're going to have to word it slightly differently?
No, Standing Order 9.7 refers to any co-option arrangement that we have, but my report recommends that we suspend standing orders only in relation to this particular arrangement that we have with the Audit Committee.
Yeah, that's fine. Thank you.
Okay.
Any further clarifications sought? I think given the input of the individual concerned to the committee, it would be to the benefit of the Audit Committee and to the organisation to have this role continued. Are we happy then to take a substantial assurance from the report, suspend Standing Order 9.7 relating to the duration of the co-option arrangement and extend the time frame of that arrangement for a period of 2 years with effect from 1st of April 22, subject to annual reviews? Yes. Okay, thank you. Ruth, no respite.
Nope. Okay, nice. Item 18. Amendments to the Area Clinical Forum Constitution. So the report proposes amendments to the ACF's constitution to permit the forum to appoint more than one individual to fill the position of vice chair. So it's been during the consideration of nominations for the position of vice chair that the chair of the forum has identified the benefits of appointing 2 individuals from 2 different professional backgrounds to support her in her position as chair. To enable the forum to do that, it would need to revise its constitution to widen the opportunity for more than one person to fulfill that particular role. So from a governance perspective, that's a perfectly competent proposal. However, we need to revise the constitution to that effect. The forum has agreed for its own purposes that it's happy for its constitution to be revised, as you can see in front of you. But obviously that's subject to board's agreement for that to take place. So you're invited to agree the revised constitution for the Area Clinical Forum.
Should say that Katrina had to step out of this meeting to attend another meeting for a time, so she's not here to speak to the paper, but Ruth has, I think, set it out very clearly what's required to be done to accommodate having 2 vice chairs. Are we happy with that arrangement? And to take substantial assurance from the report? Okay, thank you. And now for item 19, Ruth, the annual board and committee work plans.
Okay, yep. So the report seeks your approval for the work plans for 2022-23 for both the board and the governance committees. So your work plans cover a range of activities, including statutory reporting duties, regular items, priority planned pieces of work. It also provides a basis for the executives to deliver activity directly supporting key priorities and risks throughout with a structured approach. So I'm offering substantial assurance on this matter. Individual governance committees have discussed and agreed their own work plans, and the whole suite are presented here for the board's approval.
Thank you, Ruth. Any questions, any comments, or any amendments indeed? Sarah.
Thank you. It's a very small amendment, and I'm sorry that I didn't notice it before because I have seen this many times. But in our staff governance work plan, we have in the standing items that we will look at every meeting, we've got quite rightly the Together We Care strategy, and I just wonder if for completeness we might want to also from time to time look at the Argyll and Bute strategic plan as well, just so that we've got both sides of the coin. I think that'd be helpful. Thank you.
So that's page 115, is it?
Probably, yes.
It's staff governance. Yeah.
Jerry gave a thumbs up. I trust Jerry. Yes.
Okay, no problem.
Okay. Happy to add that in, Ruth.
Sure. Yep.
Alex.
Yeah, I'm the same as Sarah. I just noticed a mistake as well. In the Finance, Resource and Performance Committee planner, the standing item should include a board risk review or strategic risk review, with just as we talked to Boyd about earlier on, and we haven't got it in. I don't know why. I thought I had it in, but I've missed it. So can we put that in the standing items, please? Thank you.
That's page 111. Gaynor.
Thank you, Chair. On page 108 for Clinical Governance Committee, similar vote. At the moment, we have the Information Assurance Report as part of our standing items. However, we have had quite a bit of discussion over the last year with that report actually reporting to Audit Committee and coming to Clinical Governance on a less regular basis, so maybe a 6-monthly exception report or reporting by exception. So that should probably be moved at this point out of our standing items for every meeting. Thank you.
And would that go into a calendar of meeting at a particular point?
Yes, it should come then 6-monthly, in the same way that we have, for example, the Transfusion Committee 6-monthly update by exception and the Health and Safety one.
So can you and Ruth liaise about where it's to be entered?
Yeah, my first thoughts would be that it would possibly come in June and thereafter in 6 months.
Okay.
Okay, with these amendments, are we happy to approve the board and committee work plans and to take substantial assurance from the report? There's a lot of thumb work required today. Thanks, colleagues. And finally, Ruth, item 20, which is a verbal report.
It is. It's a verbal report. We've had a request for a non-executive director to undertake a role of a champion as environment and sustainability champion, and Gaynor has been nominated for that particular role. If you're happy to appoint Gaynor to that particular role, that would be very helpful. Perhaps Alan, if he's still on the call, he might want to give a little bit more information about what the role entails.
Yeah, Alan's with us. So,
yeah,
Alan.
sorry, Ruth, thanks for that. Yeah, what it was is part of the new environmental and sustainability group that's been set up by Scottish Government going forward in health. They've asked each board to have an exec director responsible for sustainability and environmental, and unfortunately that fell on my lap from the chief exec. So moving on with that, they've also asked for a fellow exec as a sort of a critical friend. I think we call it a champion too, which I'm currently in discussions
with Tim. I felt that Tim would be a good one, but that's not for here today. But I also asked for a non-exec to be part of the structure that we've set up also. So obviously I was doing some mentoring work along with Gaynor. I know that she had a real interest in sustainability, environmental processes, and I felt it was a good fit for the board, but happy for anybody to have another opinion on it.
Okay, I'm not looking for a rush of nominations here, but are we happy for Gaynor to be officially the ordained as the champion for the environment and sustainability? Yeah, thumbs up again. So thank you. Thanks, Gaynor, for volunteering for that role. And you'll keep us informed, well, between yourself and Alan, of issues in that very, very important area, and increasingly important area as we go forward. Okay, we'll move on now to item 21, the governance and other committee assurance reports. And we have a couple of governance, clinical governance committee minutes to cover, and ask Gaynor to speak to them.
Thank you. Yes, I gave a verbal report from the previous minutes, but you now have both the minutes of the last meeting and those previous minutes with you today. So apologies we didn't have the draft format at the last board meeting. All I need to do today is to let the board know that at committee we looked at our strategic risks, which were outlined in the strategic risk register earlier. And just to give you an update that on strategic risk 662, so the clinical strategy and redesign update, the committee agreed that we could give you moderate assurance in relation to this risk based on the update provided, and we agreed to recommend that the current risk level be maintained. So that would be maintained at medium and not high, as it says in the minutes. So apologies for the mistake in the minutes. The only other change there was that we asked that the risk profile title was updated to reflect the revised title of the NHS Highland strategy, because we still refer to, I think, a clinical and care strategy in their risk register. In terms of the strategic risk 715, the COVID-19 and influenza risk, the committee agreed that significant assurance could be given to the board in relation to the risk based on the update that we were provided at the meeting, and we agreed to recommend that the current risk level remains very high for the reasons outlined in the previous risk register conversation. And for strategic risk 959, on vaccination programmes, the committee agreed that significant assurance could be given to the board in relation to what the committee had heard on the update on that risk at the meeting, and we agreed that to recommend that the current risk level remains high. Other than that, really just to point out, there's a slight mistake in our minute meetings for our last meeting, in that we've referred to a couple of risks that were not strategic risks but committee risks, just to avoid any confusion. And lastly, really just to, I guess, comment on what Pam had said at the beginning and a theme throughout today. The committee, I suppose, has heard a variety of evidence or information in the papers coming to committee around the impact of the COVID pandemic on the patient experience, and that being less of a good experience than we would have liked to be able to provide. But Pam's outlined some of that today, and the committee hasn't seen any evidence of any major quality and safety disruptions. But there is a general feeling that patient experience is not as how we want it to be at the moment because of the strains of the pandemic.
Thank you, Gaynor, for your report. That's very helpful. Any questions for Gaynor? Okay, if not, we can move on to the Finance, Resources and Performance Committee, 24th February. Alex.
Yeah, thanks very much, Chair. Yes, in the meeting, the only real exception to report, and this was reported to the board, was that we received an annual accounts update regarding a financial loss of £104,000, which was caused by the accidental destruction of high-cost pharmaceuticals during stock receipt. There was a subsequent investigation. An action plan was raised and implemented to ensure there was no repeat of this event and that lessons had been learnt. The investigation stressed that no patient suffered any delay in receiving treatment and that the drug stock was replenished very quickly. The committee noted the report. We agreed to take substantial assurance, and we agreed that we would bring the matter to the board's attention at the next meeting, which we just did. Thank you.
Okay, thank you for drawing that to our attention, Alex. I did notice that. Yep. Any points for Alex? Okay, can we move on to the Highland Health and Social Care Committee of the 2nd of March? And
Sorry, Boyd, before I go on, I think Joanne had her hand up.
right.
Yeah, sorry, I did. Yeah.
Late for the previous item.
Okay,
Yeah.
sorry, Joanne, I can't see it.
Sorry, you're
Right.
too quick, Boyd. I just wanted to seek assurance that the learning and the investigation and the outcomes had been shared across the whole of NHS Highland, so we can ensure that there's no repeat in any other location, and that training has been, will be undertaken to implement to make sure it not happen again.
I'll follow up on that, Joanne. That was certainly the inference, but it wasn't actually stated as clearly as that. So perhaps myself and Dave will have a chat with Ian and we'll see just exactly how it's been spread across. Although, as I say, it was in receipt, so it tends to be just that one particular area where the problem may have occurred. But yeah, we'll take that on board. Thank you.
Thanks, Joanne. Thanks, Alex. Anne.
I don't have any exceptions, Boyd. I just wanted to, as you did yourself at the start of the meeting, acknowledge the contribution to the committee of the Highland Council members. I'm not exactly sure of each of them's position in relation to the upcoming election, but I do know that at least one of them is not standing again. And that Linda Monroe, for example, so the committee formally noted our thanks to all of them for their contribution and well wishes to any who are standing again. Thank you.
Thanks, Anne. Alistair's not with us, I don't think now. For the Audit Committee, was there anything that anybody wanted? Jerry, are you going to pick it up?
Yeah. Thank you, Boyd. There's no exceptions that require reporting to the board. Probably just for board members to note, we're about to enter into the year-end process, and we received the external audit plan from our external auditors, which really built on 2021 audit report, and with no significant changes. And I would bring to board members' attentions the internal audit plan for 22-23 gets ever more refined, and I would just ask those involved in the process to make sure that they're happy with the scope and the timing of planned internal audits, because that was really where the basis of the discussion was, in terms of what exactly are we trying to get out of internal audits when we ask assets to undertake the work. But that's it. Thank you very much, Boyd.
Thank you, Jerry. Any points for Jerry? If not, we can move on to the Staff Governance Committee. Sarah.
Thanks, Boyd. Nothing in particular, you'll see from the minutes that we looked at many of the papers we've seen here today, but albeit maybe in a slightly more granular level. One thing that we did have, which was a one-off or a less frequent visitor, was our annual Health and Safety Committee review, which was a very interesting paper that Bob took us through. So that was really welcomed by the committee, and we've agreed previously that we need to increase our focus on health and safety. So that was a really good way to do that. But nothing else particularly. Have to take questions though.
Any questions for Sarah on staff governance? Susan.
Yes, just one. I noted under 5.1 about the web manager post about to be recruited and graded, and that just prompted me to ask where we are with the whole project to have us a much more effective website.
Pam, do you want to come back on that one?
I'll probably ask Ruth to give us an update, or Fiona, because they're close to the details. So I see Fiona's got her hand up.
I was just trying to scroll there to see if Ruth was on. So yes, we have had the tenders back. I think we're in the process of awarding the contract. What we've also been able to do ahead of the web manager role being evaluated and advertised is we've got an internal secondment of somebody who's going to be able to spend 3 days a week starting to get that piece of work off the ground, which is really welcomed, because that allows us to really kind of start motoring as soon as we award that contract now, rather than having to wait, sort of 3 to 4 months for the post to be advertised and filled. So definitely making good progress there now.
Ruth is there, so I see Ruth. Do you want to come in?
Yep, just to confirm what Fiona's said there. So there's been a tender process and we have appointed a supplier. And so we're just in the period there in between making sure all of the successful and unsuccessful applicants to that tender process are happy with the process. That should take another week or so, and then we'll be able to move ahead, get the developer in for what we call a kick-off meeting, probably in the week commencing the 11th of April, and start work from there.
What's the anticipated timescale for completion?
So overall, we're looking at 9 months for the development, but that will be in phases. So we would expect the first phase within a few months of some of the sort of key information and the higher level information on the website to be available. And then, as I say, a further 6 months after that to migrate all of the content across.
Okay, thank you. Does that answer your query, Susan? Yeah. The next one was the Area Clinical Forum, which was a late paper, and don't think, is Katrina back yet to speak to that one? Don't see her, so I think we just have to take that as read and move on to the final one, which is the Argyll and Bute IJB, the January meeting. Sarah.
Thanks, Boyd. Yes, so our next IJB meeting is of course tomorrow, so it's a little bit out of date, but just the one thing that I wanted to bring to everybody's attention was the IJB agreed that we would extend, or we would approve the extension of the 2019 to 2022 strategic plan for the Health and Social Care Partnership in Argyll and Bute. That was in response to some delays with the new strategic plan as a result of the pandemic. So the board agreed to extend the one that we already had to allow for a seamless transition into the new one, which will cover 2022 to 2025. And that was really the only thing that I wanted to bring to people's attention. Don't think there was anything else.
Any points for Sarah? Okay, I see that Katrina has rejoined us. Katrina, do you want to say anything about the ACF meeting of 17th March?
Did you get the draft of the?
Yes.
I don't really have much to add other than the fact that sadly we weren't Corey. We thought we were, but we weren't quite. We were a man down, unfortunately. But we did have some very productive discussions, which were excellent. So yeah, and I think we asked for a change to the constitution slightly to allow for 2 vice chairs, if that was acceptable.
That's been dealt with and approved, and yet.
Fantastic. Katrina. I can let the 2 willing victims know then. That's super.
Any questions for Katrina? Any points? And I think we've got a rota of non-executives to attend meetings. And
we do, and we had a couple at the last meeting, which was really good. Really helped share a lot of information, which was excellent. Thank you.
Thanks. Okay, we're being asked to confirm that we've had adequate assurance from these governance committee meeting minutes and reports, and that we note the minutes and agreed actions from the Area Clinical Forum and the Argyll and Bute IJB. We're happy so to do. AOCB, is there any other competent business? Pam?
I'll just end where I started, just as soon as everybody's in the room, just to make you aware that the system pressures are significant today, and Catherine and Louise have already left the meeting on the basis that they need to just go and check a few things out. So you may hear comms from us to that effect out to the public, and once we have got a full assessment of the situation. But this is what most days are like, but some days are worse than others, and I think this is definitely one of the difficult days. So a few of us will be off to get together, but Louise and Catherine have already left the meeting to go and just look further at where we're at. So just to give you a heads up, and if there's any further briefing, we'll send something round by email to you later today.
And there's a press release just about to go out about the situation in Portree, where the closure of a home and care home in Portree. Graham Hardy.
Thanks, Chair. It's just something came in, just a couple of emails over lunchtime that were slightly worrying. It's just that with a new COVID programme in Argyll and Bute, I had an email from a constituent moaning that his neighbours who were in their 80s, the invitation letter was up in Inveraray, which is probably a 50-60 mile run, and they can't make it. And he was complaining about this to Jackie Bailey. So Jackie Bailey got back, and she said that she'd written to NHS Highland, she'd written to the Argyll and Bute Health and Social Care Partnership about this, and it was not acceptable, you know. And he's come back to me asking why again the chaos, you know. So just to make you aware of this, you know. Thanks.
George, and then Pam.
Thanks, yes, I was made aware of this a couple of hours ago. These appointments for the over 75 boosters were made by the National Vaccination Scheduling Service, and you're right, it's a fairly extensive problem in Argyll and Bute. Residents have been given appointments in various places not close to where they live, people in Dunoon going to Campbelltown, etc. Several problems with appointments to clinics. We're aware of it. I've got a team looking at it just now to see how we rectify it. We've put an announcement out in social media already, advising people to disregard these appointment letters, apologising for the error and saying that we'll get correct appointments issued to them where they stay. It's not something. It's not a problem that's been caused locally. These appointments were handled by the National Vaccination Scheduling Service, and they've issued letters to people across Argyll and Bute, appointing them to clinics not in their hometown.
Okay, George. Thank you.
It's important we got that message across, George, as well in any communications.
Yeah.
Pam, did you want to come in on that?
No, I couldn't see if George was still there. That's why I put my hand up. I was going to just pass on the same information.
Okay, thank you.
Thanks, Chair.
Any other business? If not, just to say that the next meeting, you'll have noted that the date of the next meeting has been changed to the 31st of May. That was because of the opening of the Baden and Strathspey hospital date being changed, and occasioning other changes. So the board development session will be taking place on the 24th, followed by the meeting of the board itself on the 31st. With that, I think we can draw proceedings to a conclusion a bit earlier than anticipated, and hopefully the weather is still as good outside, a bit colder, but still sun shining, and that you'll be able to take advantage of it on the extra daylight. So have a good Easter when it comes round, and have a good break if you're getting one around that time. And thank you. Can I just two notes of appreciation? Thanks to the board chairs for all they're doing, the committee chairs who are taking on that added responsibility, and I really appreciate the support from them. And I would also like to thank our executives because they're operating under very challenging circumstances. It continues to be a challenging environment, as we've just been hearing, around the COVID response. And I would like to just record my appreciation of all you're doing for the organisation, from led by very capably by Pam, and to the wider staffing group, to those who are in public health and other acute services as well, and all parts of community services, care services, all who contribute to the operations of NHS Highland and keep our population as healthy and safe as possible in these trying circumstances. So thank you all, and we'll reconvene as a board at the end of May. Thank you.
Thank you.
Thanks very much, everybody.
Thank you very much. Thank you.
Thank you.
Cheers, bye.